Welcome back, everybody who's doing the third webinar with us. So we're very excited. This time, we're going to reference back to number one and number two. So this is going to be a good webinar for those that attended before. And if you didn't, it's not a big deal. I basically pulled some of the slides into this webinar so that we can have a proper reference. But I would highly recommend you guys go back and watch number one and number two because they were very, very impactful about the cost cutting, physical inventory organization. And today we're going to talk about the team engagement secrets. And so before we jump into the presentation itself, I see that we have, how many people? 40 people. If you guys could go to chat and just drop a thumbs up or hello or something, whatever makes you feel comfortable. So just so we know that you guys are here and see the screen. So that's probably the biggest thing that I worry about. And then with that, let's dive in, right? So, all right, fantastic. All right, so team engagement secrets. Let's go. My favorite part of the webinar. Does this practice look like does this look like your practice? And I'm going to stick on this for a little bit longer since we're talking about the team engagement. And so for everyone who's just joining us, this is the team engagement webinar. And I'm going to leave this here so that you can see. There was a time, maybe a few years, no, 6-7 years ago, I spent a full day at the dental practice in New York. And I decided to take a piece of paper and follow a dental assistant and write down every single thing that a dental assistant does during the day. And I just put a 1 next to it. So if I see the dental assistant put the tray, I put a 1. If you did open the cabinet, put a 1. And so actually we should have done a poll on this. If somebody can guess in the chat how many individual tasks a dental assistant does during the day, that was a mind-boggling number to me. So I'm going to leave it open for you guys. If you're listening, if you're paying attention, just drop the number in the chat. And then towards the end of the webinar, I will tell you what the real number was. And so I will just make sure, write this down for myself. Now, 199 is not even close. So go higher than that. That's just as a heads up. But you can see this person here. Let's just say this is our lead dental assistant. Let's say it's Susan, my favorite name for lead dental assistant. She's holding a phone and she's trying to figure out, all right, so my banker rep told me to fax order to the certain number, right? Or where's the lidocaine cheaper? Did I order MLS? Wait, no one told me we're out of heavy body, and on and on and on. And so that goes on in the mind of your dental assistant on a daily basis. Just take a mental picture of this person, and tomorrow at your practice, you'll see that that's what's actually happening. And then obviously, the other screen that I showed you in the 2 previous webinars, that's what every single practice look like. And that's how the ordering looks like and things like that. And so it's really tough out there, I would say. I also want to remind that the average private practice spends 7 to 10% off collections on supplies, right? So all of the webinars that we're going to do in a 4-part series, the main goal for us is to help you save money, guys. Like that the takeaway is you're going to put all 4 pieces together. And today is the piece number 3, the team engagement, and actually walk away with something tangible that will help you bring it down where you don't have to waste the $50,000 on a $1 million practice on dental supplies. And Gary, 780 is still too low. Just keep trying, guys. Keep trying. So I would just say, we talked about part one webinar was cutting supply costs without the compromise. And we talked about the real tactics to drop from 9% to 4% of collections. And so again, for those that missed, I highly recommend to go back. There are a lot of actionable things. And if you really want to learn how to drop your costs, I mean, I'll give you a spoiler alert, set the budget and make sure that you actually know how to track the budget. Either have a software or the spreadsheet. Part 2 was inventory chaos to control, streamlining your dental supply workflow. Probably my favorite subject because I just love the organizational side of things. I just can't help myself. When I go to a dental office, I keep looking, what are the things that we can organize? Like even moving a vase, removing this stuff, going sterilization room. Oh my God, that's a total mess. Like how do we organize that part? And that was our webinar number 2, where we gave you guys very specific actionable things. And I also provided the downloadable guide that tells you where to buy the tip-up bins, shelves, dividers, the lab cases, bags, the prescription bags that help you store the lab cases. And we covered a lot of different things. And so today, my goal is to cover basically understanding the role of a lead dental assistant. We like to throw that term a lot in dentistry, But I don't think we're all on the same page. What does the lead assistant do? And what are the other roles available for the dental assistant in the practice? Explore methods to create ownership and accountability in the supply process, or I would just say in generally, just in the dental practice. Learn how to implement a simple incentive structure that align team behavior with the practice goals, and gain tips on communication and training to improve system adoption. To be honest, this webinar today is going to be short. I will show you maybe 3 powerful slides, and that's about it. But the key is that these slides are going to be so powerful that I'll go through the details, and all I have to do is just take it, apply it, and they will make the difference in your practice. So I really hope that you guys take it seriously. So again, as a presenter, I kind of shortened my bio back to the really important part that our mission at Zen, I'm a co-founder and the CEO of Zen One. Our mission is to empower independent dental practices with the tools and technology to thrive in a DSO-dominated world. And in short, we're just trying to empower private practice to stay private. And so that's where you see a lot of the things that I'm sharing with you are driven by the private practice that we work with. And so, Lisa, if you don't mind, let's start with the pool number one. Do you have a clearly defined role and the responsibilities for your dental assistant? Yes, no, I need to ask my office manager. All right, fantastic. So a lot of you have written, wow, 53%. That's surprising. That's a great group of people here. That's awesome. So it's a little concerning, 42% that you guys don't have it, but that's okay. It's something that you can work on, fix it. But clearly defining the roles of the role of an office, the back office personnel, I think is very, very important. I will give you my version. I don't want to say it's the best. I don't want to say it's the right one, but I'm just going to say that this is the one that we've seen implemented and it works. So, and as I said, it's going to be a pretty big slide that we're going to go through together. So it's a table that breaks down the stages or the tiers of the back office personnel. Let's just focus on dental assistants for now. And then it breaks it down on the area of expertise, which is clinical communication and leadership. So a lot of offices, and it started, actually, this whole idea started with talking to an office and they said, I just need a dental assistant. And I said, what kind of dental assistant are you looking for? They said, I just need a dental assistant. Okay. Like, what can they do? Well, I don't know. I just need a dental assistant. And so, and I think a lot of times, I think most people find themselves in that I need a dental assistant, but we don't break them down into the tiers. Do I need a sterilization tech? Do I need a junior dental assistant? Do I need a senior dental assistant? Or do I need a lead dental assistant that I can't live without, that basically runs my back office? And then we break it into the 3 areas of expertise, the clinical, communication, and the leadership. The other part that this table helps you guys to do is I really, and you will see later in the slide, in my slides, I really don't like the phrase, everyone is a leader. I can't stand it. I think it's the worst thing that we can implement for our team morale. Not everybody's a leader. Not everybody signed up to be a leader in a dental practice to begin with. There are true leaders like the doctor, the office manager, and your goal is to eventually build up the back office manager or the lead dental assistant to be the true leader. But it needs to be a step-by-step process, clearly defined, and we should understand what does it mean to be a leader when you're a sterilization tech, which you're not a leader, to be honest, right? So you're just following the process and you're showing the leadership potential that you can implement later on when you hit the tier 4 as a lead dental assistant. So let's break it down. Again, don't quote me on the clinical side, right? So you guys are clinicians. You would know much better than I am. And then when you're a sterile tech, your main job is, or your main goal is to understand the instruments, know small equipment, understand the sterilization process. From a communication standpoint, what do you call instruments internally? So every office's idea of, we call this, we call that, write it down, show the initiative that you actually want to go through and understand that the Montana jack is this and that instrument is that, and which doctor or which provider likes individual component. And then the leadership is learn to listen and write things down, learn to be dependable, right? So that's a tier 1. That's all we expect out of our sterilization tech. When the sterilization tech moves up to the junior dental assistant, we want learn this, basically learn the setups, what goes into each procedure, room breakdown, take x-rays, what retakes, learn how to assist each provider, post-op instructions, handoff. From the communication standpoint, we would want the junior dental assistant to seat the patient, and the new patient welcome process, right? Not to be awkward around the patients. And again, it's the learning process. After they've been the sterilization tech, we move them up here. And then from a leadership standpoint, manage your time in the schedule. So being able to look at the schedule and see what's happening tomorrow, what's happening the day after tomorrow, what's happening for the rest of the week. So, and that also requires the training. And actually, you can build the SOPs around these blocks here. When we're looking at the senior dental assistant, what we want is from a clinical standpoint, and again, these are just the basic stroke of a brush kind of thing. Single unit temporaries, adjust removables, appliances, take final impressions, expert in practice management software, master shade selection, presenting and signing consent forms. From a communication standpoint, what we're looking for is the managed back office personnel schedule. So somebody who can not only look at her schedule, but look at somebody's else in a tier 2 schedule and say, you know what, you're going to be in room 4 tomorrow helping this provider. And obviously own your own schedule. I kind of missed the leadership. I wonder what happened here, but I will have to go back and update it. But the main point, now we're looking at the lead dental assistant. So the tier 4, I mean, that's your go-to person in the back of the office, right? And maybe you hired that person to begin with to be the lead dental assistant, or maybe you had somebody who started 10 years ago as a sterilization tech and moved themselves up to this position. And from a clinical standpoint, it's helping providers to run on time, right? High-level specialty procedures. So somebody that you would take with you as a doctor when you go and take implant course or endo course or any new course, you would take this dental assistant with you so that you guys can speak the same language. If you move your hand, they know exactly what instrument you would need. From a communication standpoint, we're looking at the managed communication between the departments. So now this lead dental assistant is not only looking at what's happening with all the dental assistants, but they can also talk to the hygienist. They can also talk to the doctors. They can also talk to the front office. And so that's a very, very important role. And at the same time, we're talking about from a leadership standpoint, it's being able to coach the tier 1 and tier 3, between the tier 1 and tier 3 people, ability to take the learnings from any clinical trainings and convert them to SOPs. And I'm sure you guys have heard the term SOP so many times. And so again, that's the person that you trust to take with you to courses, knowing that he's going to come back, put an SOP, implement it, and that's going to get done. So I really wanted to give you guys a breakdown here of how I've seen the tiers being implemented in the more clear structure. I can't stress enough that it helps offices to even help with HR issues, like the raises, the questions about this, the questions about that. So it helps to avoid and also fill the gaps. So when you sit with your team and say, all right, how many tier 2 assistants do we have? All right, we got 2. How many sterilization stacks? And from what I've seen successful offices, they always keep the tier 1 position open. So they're constantly trying to get the right person as a sterilization tech, train them, see how they fit. If it's a good fit, they train them to be the tier 1, and then hopefully the tier 1s move to tier 3. And so that gives you the roadmap right here. All right, let's keep going forward. So again, everyone can be a leader. Please make sure that if you are designating a leader, you actually give them enough responsibilities, but it's also, you're not taking I'm looking for the right word. You're not taking away from them by saying that everyone is a leader. So if we want to call the lead dental assistant as the leader, that means every other dental assistant can be a leader. They have to make sure within that team, there's one leader. All right, so let's keep going forward. Lisa, let's run poll number 2. What's an effective way to build ownership in the inventory process? Oh, fantastic. Everybody's on the same page, creating clear goals and incentives tied to performance. Phenomenal. All right, let's take a look at the subject together. All right, so the phrase that I hear a lot when I go to the dental practices that dentists or office managers would say, and it's not, nothing is wrong with that you guys are saying, or you would say that. I just think that it has really, it backfires later. Basically, the phrase is, I would like to have everyone to be in charge of the inventory, or everyone to be in charge of my back office. That doesn't happen that way. So again, my recommendation is pick one DA to run inventory and ordering. We call them Zen masters, right? So you need to have somebody who's going to be in charge. And that person goes through the trainings. That person, when you sign up with the right software, goes and does the training with the software. That person is in charge. So the idea that, oh, we're going to now take the full inventory supplies and we're going to consolidate it among everybody. The hygienists will order their own stuff. the doctors will order their own burrs, and then this assistant will order just the infection control, and then this assistant will order restorative. No, that doesn't work. So one person is in charge. Every order or everything that needs to be ordered comes to that one person. And I believe I have it somewhere here. You know what? I deleted the slide, but we covered the spreadsheet on, I believe it was on the second webinar, the spreadsheet, the room inventory. And again, at the end of the webinar, I'll have the QR code for you guys to scan that the form is going to be there. So for each room, you're going to have a dedicated person. That person fills out the spreadsheet of what they need. And with that spreadsheet, they come to the main lead assistant who is going to be in charge of ordering. So again, the spreadsheet's available, or you can sign up with Zen. Sorry for a shameless plug, but we have all that available. And then once fully trained, add another DA as an apprentice, meaning you've trained Susan to take the lead and become the assistant, the lead dental assistant, right? So now you can say, you know what, I'm going to pull up the tier 2 or even tier 3 person to start helping you. And so now the two of you can piggyback from each other. And again, within the software, you have the ability to allow the person to add products to the shopping cart, but they can't check out, so that the person who is in charge can go to the cart, review, and process the orders until the person is fully trained. So when you have the two people, you have the lead dental assistant and you have a tier 3 assistant who's the apprentice. That way, if Susan goes on vacation, nothing stops. You got the tier 3. If the tier 3, something happens to that person, the apprentice, you just pull another tier 3 and you start training that person. So you constantly have an ongoing process of somebody's always going to be in charge of your supplies. It's never going to be, oh, that person left and they took all the passwords. They're gone. I don't know how to order supplies. I don't even know my I don't know, like, how did you do that? How do we order supplies? That should never be the case if you implement the system properly. Now, give them the tools. I'm a big fan of the tools, right? So if you can't afford, start with spreadsheets. I think most of the offices can't afford, get the ordering platform. I'm also a big fan of not, so most offices use American Express. I don't know why, but probably the point. But I'm a big fan of creating an account with Brex or Ramp. So what these two things do is they will allow you to create a virtual card. You can literally go on Ramp or Brex. It's your choice. I'm not getting paid or anything, but you can go to one of these platforms and choose and create a credit card by the name of the vendor. So let's just say it's Buy Horizon, right? So you can create a credit card, set the limit, issue a virtual credit card to your assistant, write down the number, and she could use it, right? And you can even call Buy Horizon and say, this is my credit card. And so when they go over that monthly limit, they just can't place orders. It just blocks them, right? So that creates another mechanism within your practice that people can't just take advantage of you not like paying attention to things. And again, once it's set up and organized, and you probably need like 5 or 6 virtual cards, you're good to go. Again, you can also do this in Zen. You can put a credit card and you have a budget and nobody can go over the budget. Then get an office mobile phone so that people can scan the products and use it as a scanner to scan the products if you're utilizing the software for the QR codes, which we talked about in the webinar too. And then get a dedicated workstation for ordering. I've seen way too many times when assistants are using Staff Lounge, which is okay. They would have an iPad, they would sit there and they would do their ordering from there. But the worst that I've seen is going to be a what do you call it? A basement that's not finished. That assistant is sitting there and trying to place orders, and that's not a good environment. So I can't stress enough a computer that's always there, like a hallway station that you just put there, and the person knows that these are my notes. I will just go in. I will always find it. And then other people in the office know if Susan is in charge and that's her working station, we can drop the notes there for her to be able to place the orders, and she will not forget what we need. So again, these are the 4 things as the tools. And then we're poll number 3, Lisa, if you don't mind. Would incentive bonus plan help your team? I'm just curious. What do you guys think? All right, let's take a look. Actually, wow, I expected this is going to be a 50-50 because from what I've seen in the past, a lot of people not really excited about the bonus plans and incentive programs, but I like what I see. So let's take a look together. So I really think that on the implementing an incentive plan really aligns everybody else in the office to stay within that goal. At Zen, I see this all the time. If I talk to an office that I talk to dental assistant. The couple questions that I ask: do you have a budget? No. Do you know how to track it? No. Who do you order? It's going to be, oh, we just order from call my favorite top three company, and that's all we do. Okay, do you have a process in place? No. All right, here's the different scenario. I call an office, we do a demo. Do you have a budget? Yes, it's 4% off of my collections. All right, fantastic. Do you have an incentive program behind it? Oh, yeah, do. I do have a bonus if I hit my goal. And if I keep my office within 3%, I get this much. Oh, wow, that's great. Who do you order from? These are the 5 companies I order from. How do you order? Well, I do have online accounts set up and I have the Google spreadsheet and this and this and this. And then I go to the doctor and I say, how did that happen? And the doctor looks at me and says, what happened? I have no idea what you're talking about. So the assistant who's got the incentive program attached to the goal actually got stuff together and organized it. So magically. So I'm a big fan of the incentive program. And on my webinar 1, I showed you guys the spreadsheet where you can add up all of the expenses, right? So at the top, you're going to put the collections, and then you're going to list all of your vendors. And then just as a goal for your assistant, you're going to say, well, best out there is 2.9, amazing 3.5, grade 4, good 4.5, right? And so you're going to put this spreadsheet so that the assistant, after each order, can go in and fill in the totals for that month and what it was, so that we can calculate the total right here. And then we can see the percentage collections, the actual, the target, and what did we beat the benchmark. And then that spreadsheet will allow you then to go and say, all right, here's going to be my incentive program. And the one that I've seen that works is this one, the 3-month rolling average, right? So you're going to look at, just if I go back here, we're going to look at October, November, December. We see that on average, we are on budget. And then did we beat the benchmark or we didn't? So we see the number, we see the percentage. All right, fantastic. So that means now you're at 5% and above, you get nothing. Between 4.5 to 5%, you get $500 a quarter. Or if you're 4 to 4.5%, you get $750 a quarter. 3 to 4%, you're getting $1,000 per quarter. Now, I did not want to put specific dollar amounts because it really depends on the size of the practice, right? So if you're doing $20,000 a month in ordering, I would make these numbers triple so that your assistant actually has a skin in the game. And don't be afraid, because your savings are going to be greater than that, right? So if you're doing less than that, maybe you even start with 250, right? Or 150 if you start up. So adjust the numbers accordingly to where you think you're going to be. But this is a rough breakdown, and make it really clear and make it really easy for assistants to be able to see the budget, because they're the ones ultimately that are going to be responsible. And trust me, they will try to count every single thing to hit that number and hit the bonus. So it would be a great way to look at it. And so again, this is the spreadsheet. It will be available for the download at the end of the webinar so that you guys will be able to get a hold of it. So that's pretty much on an incentive program. There's nothing crazy. The craziest part is being able to implement. So literally tomorrow, if you're off, go to the office, look at the numbers, put a spreadsheet, put all the expenses from the vendors, just start doing it. Put in percentages, look at how much you usually spend per month, add up the numbers. Maybe these are the right numbers for your practice, the 500, 750, and 1,000 per quarter, and then decide how you're going to do it. And talk to your HR people. Do you add it part of the, like a payroll, or do you buy a gift card? Whatever your CPA or the bookkeeper will say, that's how you can do it. And so the final thing, I like the slide, and we've talked about different elephants in the room, but this time I want to talk about in the objective, we discussed what are the best ways to communicate and make sure that the systems, at least related to the supplies, are being implemented. And I can't help, but I always think about this picture. This is one of my offices, and when I visited, it was probably so unique because I took a picture right in the middle of it, is when the doctor was actually entering every single invoice in the system. And then I asked, that's Dr. Johnson. I said, Dr. Johnson, do you actually do invoice? He's like, no, I also review every single order. And at first I thought he doesn't really trust the assistant, but that was the opposite. They were working together. So she would come to him and say, these are all of the orders. I put them together. It's all in a shopping cart. Again, spoiler alert, they all use Zen, but it's all in a shopping cart. We put all the products there, but then they're able to go and review it all in one place. And it didn't take that long for the doctor just to make sure that they're reviewing the product. I will tell you the big difference. We covered that during, I think, first webinar. The big difference between when an assistant places the order and the doctor, there are two separate mindsets, and they're very different. They're not wrong. Both are right. The assistant is always going to try to buy more because she's afraid of running out. The doctor, who's going to look at the schedule, will try to buy less. And so the conversation in the middle is actually what's important. So in this case, assistant might say, you know what, doc, we need 5 boxes of lidocaine. And he will look at the schedule and say, you know what, I only see the need for 3 boxes of lidocaine. Let's be real. We have patient this, this, and that. These are the days. This is how much we're going to use it. Let's just put 3 boxes. Trust me, if we run out, we have an extra box sitting. We'll use that. And so that's the process we're looking for. And so I can't stress enough for you guys that the doctor is involved in the approval process of every single order. And then if you want, take a next step, enter the invoices in the system. And so what we covered today is keep your inventory. I mean, that's from the last, but I think it's still relevant that in order to have a successful system and not have your assistant lose their minds, keep your inventory under 300 SKUs, implement the spreadsheets, sign up with the ordering platform, one person in charge, and bonus your lead assistant based on amount saved. So it has to be tight how much they save. And the more they save, give them the more money, right? So as we covered in the previous slide. And just a final reminder that every dollar you save is a dollar in your pocket. We covered that 3 times already. Everyone is already paid. And sometimes all it takes is a one good system to elevate your practice to the next level.